it's very challenging to live with whatever we carry.
Centerstone is a one-of-a-kind place.
And it was the best decision I ever made in my life. There's nothing holding me back anymore.
We're hanging in there. And, you know, right off the bat, Stacy, I really appreciate your time. We chat with Centerstone on the first and last Wednesday of each and every month and tackle this really important topic. And as we get started, you know, to familiarize yourself with our audience, take us through your day-to-day with Centerstone and your background with the organization.
Sure. I actually started at Centerstone 9 years ago as an outpatient substance use and mental health counselor. So now I have the abilities and capabilities to lead our addiction treatment services. So I oversee every level of care here for substance use service.
And as the clinical director, as we've been talking about the Recover With Us campaign, you know, what are the primary goals of the Recover With Us campaign? Because, you know, for me, Stacy, and before we go forward in this, it's better to know this information before you need to know it.
Absolutely. I mean, really, the objective is always to expand treatment services, allow people to access our treatment services easily, and educate and reduce the stigma that's associated with addiction.
And Stacy, when I was reading your bio on Centerstone, I was learning about, you know, some of the work that you've done with the medically, MAT. I always get the M wrong. Is it medically assisted treatment?
Yes, or medication-assisted treatment.
And, you know, when I read that, it's really great to know that this is something that really you've been able to tackle and keep adding to under your role here. And now take me through this. In your words, someone who's really lived MAT, take us through what exactly it is. What does it entail, and how does it benefit the individuals that are suffering from those disorders?
Sure. So medication-assisted treatment is for individuals who are addicted to opiates. The benefit of MAT services is it combines medication and counseling. And over the years, we've really evolved. We've been able to add some case management services as well peers, so individuals who are in recovery themselves, in order to help support people initiate their recovery and support and sustain their recovery as well.
Well, and Stacy, when we were talking about MAT the first time, it just seemed like one of the most important programs in Centerstone because of the peer support, peer recovery specialists, and how important that role is and how invaluable it is to have someone that can really connect to that individual that's battling through this. And, you know, it sounds like a silly question for me to say, but it is a poignant one. How important is MAT, and how important are programs like that to really help the area tackle this crisis?
I think it's really important. We're seeing more and more individuals. Obviously, we have an opiate crisis, and we have had one for a very long time. The medication piece allows someone to address the physical symptoms, meaning the withdrawals, the cravings. And once we can get the medication stable and addressing those physical symptoms, then we can really dive deep into those counseling issues, concerns, you know, mental health that might have led to the addiction in the first place.
And Stacy, on top of the MAT, one of the other programs that we talked about that I found so fascinating and really helpful was the Fellowship Campus, the Fellowship House Campus. And take me through the range of services that are available for individuals. And I know that we're kind of going through the gauntlet here, but with having you on, I definitely wanted to get your insights on all that we've been covering so far for our audience. And when we talk about the Fellowship House Campus, take us through some of the ways that individuals are helped over there and just the benefit of being on a campus like the Fellowship House.
Sure. So Fellowship House is in Anna, Illinois, and we offer detox and residential services. So we consider in the substance use world, detox is one of the highest level of care. So individuals can come in there and be medically monitored by RNs and our physicians to cope with the physical withdrawal of their detox. And then a lot of those folks choose to move over to our residential treatment site, which is the same site.
Yep.
It's actually a beautiful campus in rural Illinois. But in the residential treatment piece of it, we have counselors, we have those peer supports, we have medical staff, and they are providing an intensive level of treatment. So the clients that are there live there, and they receive at least 25 hours of clinical services every week.
Well, and to me, whenever we were really discussing that and going into the deep dive of Fellowship House, it seemed like such an invaluable component to Centerstone's overall organization to have that campus to where you're really, in a beautiful area that's a little bit more laid back, and you can really focus on what's important, and that's the recovery.
Yes, absolutely. It kind of takes you away from the hustle and bustle of the cities, right?
Right. Well, Stacy, how have these programs been developed through the years? Since you've been there, how have they evolved before we go any further? Because it seems like each time I talk, there's normally a new component that's being added. There's something that's being looked at being added at least. Can you fill me in on that from your perspective?
Yeah, so I think that a lot of what we learn is what the needs are, right? And so the needs that we're seeing right now is a really more intensive level of medical intervention from the detox from service, and then a lot more significant or severe mental health diagnosis that need to be addressed to help people recover. And whether that mental health came from the addiction and things that have happened during addiction, or if it was before the addiction. So treating both mental health and addiction hand in hand is so very important.
It was eye-opening to me, Stacy, to hear about, when you bring someone in that maybe for the first time or maybe for the first time in a while that's coming back in, that, medically, there's so many things that need to be worked on first that it just really opened my eyes to the lack of self-care that happens whenever we're on that road and what we're forgetting about.
Yes. And so that's actually a very good point as well. It's not even just the medical detox piece of it. It is the actual physical medical symptoms that have been neglected for sometimes many, many years that need to be addressed that the individual might have had to begin with, or they could have as a result of substance use and addiction.
Absolutely. And Stacy, I wanted to talk to you a little bit about the transitional housing facility in Marion. And it's one of these programs we first talked about was CRTH. I'm trying to get all my acronyms right this morning. But to me, this is a crucial role in supporting individuals that are newer to recovery. And in your own words, can you elaborate on some of the types of treatment again, just to give a bit of an overview for our audience, if in case they missed it?
Sure. So a lot of what we wanted to do when we were building our addiction continuum at Centerstone was have every level of care, right? So someone can start in detox, they can move to residential treatment, and then if they want to, they can move to the transitional housing that's in Marion. So in Marion there, it offers a longer term support. So residential treatment is typically 28 days, and you have a lot to accomplish in 28 days. And so from there, they can move to Marion, and that program, they can be there up to 6 months. So someone might live in our program that does not have a safe home environment to go to, or they just want a longer time to be surrounded with people who are in recovery and developing those skills. So the recovery home in Marion is staffed by peers who are in recovery themselves. It's a small group of folks, and then we help build skills that people might need. So if they need help getting that first job and need help saving the money and need time to save money to move out on their own, it's just a really wraparound approach to giving people a longer amount of time to live in an environment of recovery if they need that.
Well, and something that I think is so great about the program, especially when it comes to that transitional housing, Stacy, is the fact that when we talk about, someone on that road to recovery, we might not, as family members, as loved ones, as friends, not realize for 3 or 4 years, there was a whole nother way of life that our loved one became accustomed to. So to be able to, especially, first steps in the process, to be able to go and really seclude yourself for a couple of months and refocus, regather everything that we need to gather and just get, reintegrated into a regular, daily schedule, that's got to be huge for success long term.
Absolutely. I mean, change takes time. And a lot of our folks that are in early recovery, we're asking them to change everything about their lives, right? Everything that they knew, they have to adjust and develop new skills. And you would reference, family and friends and being supportive. And that's absolutely so important, but some of our folks don't have anybody either.
Yeah.
And so having that recovery support, even if it's the people that they live with, it is vital in those first couple of months, and especially in that transition to making those changes permanent.
Well, and Stacy, to go back to what you were just talking about the 28 days and how much work is being done in those 28, that's something we really never have dived into in these conversations yet. And if you could, just for a couple of seconds, elaborate a little bit more on how intensive those 28 days are for folks that maybe aren't aware on some of the things that are being tackled right away when you're going in.
Sure. Like sometimes I reference this for individuals that are unaware that it's a job, right? So you go to Fellowship House and you are in a clinical service every hour, almost every day. Of course, there's breaks and there's lunch and there's recreation time. We have to have some of those downtime, right? But it's very much a deep dive into your mental health, your recovery, what led to your addiction, how to develop those skills and really fine tune those skills to prepare yourself to reintegrate back into society. And so we have to think that some of these habits that we're trying to break in 28 days, 10 years of a habit. Yeah. It's a lot.
Well, and I think sometimes, and that's why I'm so glad we're talking this morning, especially about this, because for loved ones, and we've talked, just like you said, some don't have that, but for families that are individuals that do have families and friends that are going, if something happens, things are going great for 5 years, and then, something unfortunately kind of disrupts that chain, they're first to kind of, get upset and attack, but they don't realize, like you just said, 10 years of an addiction, and we're only 5 years into the recovery, there's still a lot of time to make up for, and things happen.
Absolutely.
And Stacy, I wanted to ask you a little bit more about MAT and addiction treatment. And, with your extensive, experience in this and really adding to the MAT program, what are the biggest challenges? Is it external challenges? Are they internal challenges, societal challenges? What really are some of the obstacles that you guys face in this field today? And is social media even becoming a factor because you have folks living false lives about partying and look how fun this is?
I think it's all of it. In social media, when you think back over, 50 years, you can see how substance use is actually glamorized. And we're still doing that, right? And it's still acceptable. Except when we shame individuals who are then really in a full addiction, right?
Right.
So I think that there's going to always be an ongoing need for education, an ongoing need to reduce stigma associated with addiction, to help those individuals. I mean, there's a lot of shame involved in substance use. And then as a community, how we approach folks that have an addiction. I think that we really need to continue to work on changing our mindset.
And Stacy, that's a really good point, because we talk about how it's becoming better, it's becoming more okay to discuss these topics, but what's not becoming easier is for the individual to put themselves out there, sometimes and say, here's what I went through. Because, society wants to talk about, and from personal experience, we all make, especially when you're on that road, things happen and you aren't, you make decisions you wouldn't have made today. And sometimes I think society's so quick to jump on somebody for making past mistakes, 6, 7, 10 years ago that, we kind of just keep focusing on those mistakes instead of the person recovering and just supporting them, saying, hey, yeah, you were going through that, but let's get you back up to normal together and we'll keep rolling.
Absolutely. Absolutely. And then also continuing to expand the services that are available, because there's never enough.
I was going to ask you about the 6-month program again, because to me, if I'm Centerstone, I want 800 of these around so everyone can go and be a part of it. And is that a struggle too, because of, just resources and knowing there is a need for this program and it's working, but just trying to make sure we can expand it to reach as many as we can?
Absolutely. And a lot of it, it's funding, it's staffing, it's availability of a building and location in the community that can be accepted. So there's a lot of variables that go into that. But you're right. We see that it works. We see that it's needed. It's just getting it there.
Is starting younger with our children at home and maybe not, breaking down, substance use disorder to our 7-year-old, but, as they get older, just kind of having those conversations and talking about mental health, are you seeing somewhat of more acceptance when we start younger, or does it have any effect at all?
I think we've made a lot of progress talking about mental health. I think that we can continue to make progress about substance use. And I think that I think that you're spot on with that. I think that there's never too much education for our young people and starting at that young age. As far as, I don't think that educating sometimes hasn't, it's not going to prevent someone from having an addiction. But that's where we need to be able to educate people about, then what, right? What can I do?
Right. Well,
what are the warning signs?
Well, and that's to me why we started doing these segments. I remember in December, I reached out and said, just to have this information, if we can help one person whose loved one or themselves are going through this, they don't know where to turn, if they can find it and we can really start that progress, that to me is a win. And, it shows really just how crucial it is, especially in Madison County, because you're right. We've been in an opioid crisis for over 15 years and it just keeps getting progressively worse. And we got to tackle them. And Centerstone utilizes a comprehensive approach to your guys' treatment. And I think it's so important. And can you discuss the benefits to this approach for both your clients, but also just your employees, also your staff too? Because it seems like this comprehensive approach not only benefits the individual going through the program, but also helps other employees at Centerstone provide that all-around care to really tackle it all too.
Mm-hmm. Yes. So we do a comprehensive assessment when someone first comes into services to see where their needs are. And sometimes someone might only have one need area, but sometimes they have all of them. So then it's what's first, how do we address the most pressing issue, and then go from there. But I think that we have to look at a whole person and individualized care, because everyone's experience and needs are going to be different.
And Stacy, as we're talking about that too, because I was thinking the other day, there's so many folks, especially around my age group now, that are hitting the wall because you're out of college and now we maybe aren't finding the job that we wanted, or we're still living at home, and you never know. But all of a sudden, the morale is a huge problem, and there's becoming a crisis of confidence for certain generations. And what's your advice to somebody that knows they're struggling, that knows, hey, it might not be substance use, but it's still a mental health, health aspect, and maybe it's anxiety, maybe it's constant fear, maybe it's depression, maybe it's this. What's the best way to really start helping yourselves and taking that chance? Because it is scary to make that first phone call sometimes for folks that maybe have never gone down that path.
It is. And I think that, it doesn't have to be a major issue to want some guidance or help. And I think that that's where the big thing is, right? People put it off until it's very, impactful in their daily life. And so it's like maybe some of those early interventions would help. And I want to encourage people to reach out and not feel bad about asking for help.
To me, it's almost like a crack in the windshield. It's just going to keep getting bigger and bigger until we go and call, one of our window companies and get it fixed.
Absolutely. If you put off, taking care of any type of one of your needs, it's going to get worse, right? And I think that we've seen a lot of that actually through the pandemic as well.
And Stacy, as we go forward here, what are some of your takeaways just being in your position at Centerstone? Because you really have, I feel, a better gauge on just how the staff works, how some of the clinicians work, how your peer recovery specialists operate. Whenever you're able to kind of see all these wheels in motion, just take me through some of the feelings you have just and thoughts going forward for the future of Centerstone, some of the employees and your organization just as a whole.
I think that it's always a team, right? It's never just one person, and any one of us could have an impact on any person. And it doesn't matter your role or your experience. It just connecting with folks. And I think moving forward, we can always adapt and develop, right? So we've learned things over the years, and then sometimes we need to pivot, but that's okay too.
100%. And now, do you have any plans in further enhancing, any of the programs, or is there anything developing right now? Because I could only imagine all the nuances that do arise throughout the years. And is there anything that you can fill us in for individuals dealing with SUD?
We're always looking for opportunities to help folks, right? So just like we had talked about, we recently opened our transitional housing program in Marion, and we've seen a great benefit to that, right? So the next step is always, well, then where else can that happen? Who else can we help? And how can we make services more readily accessible? And obviously, we have this great place down in Anna, Illinois, but it might be hard for folks to get down there. So I'm always looking at different ways to expand our services to make them more accessible. There's a lot of talk around mobile units and vans in the community. And so we're always looking for the next opportunity to help clients.
100%, Stacy, and it's just great speaking with you today, because to get really your gauge on things, as we have talked with Centerstone for 6 months now, has been really beneficial this morning. And now, before I let you go, do you guys at Centerstone ever have the opportunity? I know you're always moving, and you do have community support pieces to the organization, but do you guys speak at business council meetings or schools to, if possible or if invited, to inform the public on some of the work that you guys do? Because I was just thinking, for the business council, for folks to hear this and hear, directly from Centerstone, that's really beneficial too.
Absolutely. I mean, we're willing to provide educational presentations about the services that we have. We have a lot of grants that we're implementing, that we do a lot of presentations in those capacities, and really want to be involved throughout different communities so we can all work together to get people help, no matter where they independently reside at.
And Stacy, one last question for you. I know I'm keeping you longer than I said I would, but it's just been really beneficial for us. And my one big question always to everyone from Centerstone is, we always talk about, it's not a one size fits all. It's not, it doesn't discriminate. Addiction doesn't, and it could be anybody at any time, and you don't know. And throughout your time at Centerstone, I can only imagine how many different age groups and ranges have you seen in your care, because I think that helps society, our community to know that you aren't alone if you're in this. If you're 70 years old all the way down to 18, you guys have dealt with it.
Mm-hmm. Absolutely. Yes, we treat a variety of age ranges. I will say, just in my experience, so I've been at Centerstone for 9 years. And when I started at Centerstone 9 years ago, the population was probably more middle, 40 to 50. And what we're seeing over the last couple of years is much, much younger. Our average population is probably in their early 20s.
Oh. That's actually pretty eye-opening, Stacy. I didn't hear of that before. And Stacy, I really appreciate your time. It's always a great pleasure to speak with Centerstone, because this is why I do these show segments. It's not to really pay the bills. I always do these to really inform and have a mission behind it too. And thank you so much for helping us deliver on that mission too.
All right. Thank you so much for having me.
No problem. We'll take a quick break here. Recoverwithus.org is the website. If you or anyone you know needs help, and maybe it's great to have that information before you know it, bookmark it in case you can help somebody on the road to recovery. Stacy, the clinical director with Centerstone, thank you so much for your time, and we'll take a quick break right here at 940.